Hi, everybody. This is Renee Diaz. In this voiceover, we are going to talk about communicable diseases. So this slide just shows you the outline for the voiceover. We're going to first talk about viral communicable diseases, and then we will discuss bacterial communicable diseases. So this is a list of the viral communicable diseases we're going to talk about: Erythema Infectious, hand, foot, and mouth disease, rubella, mumps, rubella, and the varicella zoster. So the first communicable disease we're going to talk about is Erythema Infectious. This is also commonly called fifth disease. It's a very common school-age child illness, usually between the ages of 5 and 15 years. It is a self-limiting illness, and what that means is it usually will resolve on its own, okay? It is hallmarked by the lacy rash that lasts for weeks after the infection. It's transmitted through respiratory secretions. Some other symptoms can include a fever, upper respiratory symptoms, a headache, and you'll see that slapped cheek appearance where it's bright red on the cheek and then the lacy rash on the trunk of the body and on the arms. Typically, it's cared for at home, but sometimes if the client has sickle cell or an immune deficiency, they will be inpatient in the hospital. And at that point, you'd want to make sure that the client is on droplet precautions to avoid the spread to other patients in the hospital. When it's cared for at home, the role of the nurse is really to provide education to the caregiver. And at this stage, it's simply just to administer antipyretics, so sometimes Tylenol or Motrin, to make sure that they stay hydrated and keep them comfortable. Hand, foot, and mouth disease is exactly what it sounds like. It's an infectious disease that takes place having blisters around the hands, feet, and the mouth. You can see the image at the bottom right-hand corner of the screen. Sometimes it actually will cause the nail beds to have blisters underneath them, and then eventually the nails will fall off. This is common in infants and children less than 10 years of age. Again, it is self-limiting. Usually it resolves within 10 days. Some of these children may have poor PO intake, and that's usually secondary to the oral blisters. It's transmitted through contact droplet and the fecal-oral route. Some of the symptoms include cold symptoms, runny nose, fever, sore throat because of the vesicles in the mouth, and on the palms of the hands and the soles of the feet, and it's very painful for them. As the nurse, you want to provide education to the caregivers to have good hand hygiene. They should disinfect all of the surfaces and toys, especially if they're infants or toddler, because they're very oral focused. For food, it's best to have a bland, soft diet. And then again, to try to help relieve some of that pain and keep them comfortable, they can be given acetaminophen or ibuprofen. Now we're going to move on to measles. You may have heard about this a little bit in the media because there has been some outbreaks. This is typically affecting children who are not immunized for whatever reason that may be. It's a self-limiting illness, usually resolves within 7 days. As long as there's no complications to the illness, it can last longer. It is transmitted via the airborne respiratory droplets. Some signs and symptoms of measles include cold-like symptoms, a cough, fever, conjunctivitis, malaise, a rash that you can see in the picture in the bottom right-hand corner of your screen. The rash typically starts about the headline and then it spreads down to the toes. Some caregiver considerations should include to administer acetaminophen and ibuprofen, and especially to isolate the child at home so it doesn't continue to spread into the community or within the household. Maintaining hydration and having that soft, bland diet is very important. If the client is hospitalized, which they are commonly hospitalized for their complications, they are going to be on airborne precautions to help avoid the spread. Some complications of measles include ear infection, diarrhea, encephalitis, pneumonia, seizures, deafness, mental retardation, and even death. Now we're on to mumps, which again typically affects children that are not immunized. The transmission happens via airborne droplets or contact with infected droplets. And this is in the oral and nasal secretions. Some signs and symptoms of mumps include swollen parotid salivary glands that are right in the front of and below the ear. and it extends through the jaw. So you'll see in this picture in the bottom left-hand side, it shows that salivary gland and what it looks like on a real client. In addition to the swollen gland, it's typical to have a headache, fever, earache, muscle aches, malaise, and often a poor appetite. It's really good for the caregivers to know that they can administer acetaminophen and ibuprofen. They should promote hydration. They can, again, provide those soft, bland foods in the diet. You can either have ice packs to the site or warm compresses as well to help promote comfort. Some nursing implications include droplet precautions if they're hospitalized or in an inpatient setting. Some complications include meningitis, encephalitis, glomerulonephritis, sterility, myocarditis, and joint inflammation. If someone has this infection during pregnancy, a common complication is fetal death. Moving on to rubella, which is also called the German measles. This is a rash that is pretty similar to measles with it's that same kind of rash, but it's a different illness. It typically affects children and adolescents that are not immunized. Again, it is a self-limiting disease that usually resolves within 3 days. Sometimes it can last up to a week. Typically, it's transmitted through respiratory droplets and direct contact with either respiratory secretions, blood, urine, or stool. The signs and symptoms of this illness is the fine pink or red rash to the face that spreads downwards. Also, with the rash, you will sometimes see malaise and body aches. It's really important to educate the caregivers that they can administer either Tylenol or ibuprofen for the fever and joint pain, just to help them feel a little bit better. Some nursing considerations include to educate the parents or caregivers about the MMR vaccine. That's the measles, mumps, and rubella vaccine. And this is especially prior to childbearing age, which I'm sure you heard about in your pregnancy lectures. We'll also talk about that when we discuss immunizations. The patient with rubella should also be placed on droplet precautions until 7 days after the onset of the rash. The last viral communicable disease we're going to talk about is varicella, which is called chickenpox. It's very common, again, in children who are not immunized. They can be infected if they're immunized, but it's very rare, and it's usually less severe than somebody who's fully immunized. It's also important to know that once somebody's infected with this illness, it does stay dormant in their body for years. And then if for some reason later in life they have a weakened immune system, they can end up with a secondary infection called shingles. And this can come out, with the older children and older adults. Transmission is through fluids from the vesicles themselves when they pop open and leak. Also respiratory secretions. So it's airborne through coughing and sneezing. It is also important to note that children and infants cannot have aspirin due to the risk of a life-threatening illness called Reye syndrome. It is an illness of the brain and liver. We've also talked about giving ibuprofen. I also want to note that that's only safe for infants that are over the age of 6 months, because before that they have too immature of renal function. If a child has chickenpox and they are in the hospital, they will be placed on contact and airborne isolation. Okay, so that wraps up our viral communicable diseases. We are now going to move on to the bacterial communicable diseases, which will include pertussis, strep throat, and scarlet fever. Pertussis is commonly called whooping cough. It's a serious infection with infants and young children. Older children can have it as well, but they just handle it much better because they have larger airways. So with infants and young children, it's a severe respiratory illness that can lead to respiratory failure. And of course, after that, it could lead to death. It's transmitted through oral and nasal secretions. They usually start off with mild cold-like symptoms, and then it progresses to that distinct whooping sound that's heard during the coughing spells. You can click on the link on the slide. There's a couple of links, and you can hear what that sounds like. Caregivers can provide cool mist humidification at home, and they really need to be educated on the signs and symptoms of respiratory distress in infants. There's also a video on the slide that shows you the different signs and symptoms of respiratory distress, just as a reminder. A child hospitalized with pertussis would be placed on droplet precautions, and it's really important to offer reassurance to the child and family because these coughing episodes can be very scary. Finally, we have strep throat and scarlet fever. So strep throat is caused by group A streptococcus. It's common in children greater than 2 years of age. It is transmitted through droplet or direct contact with the secretions. Some of the symptoms include sore throat, fever, headache, enlarged lymph nodes, poor PO intake. Scarlet fever is strep throat with a fine red textured rash. It's a sandpaper-like rash, and also a red tongue called a strawberry tongue. You can see a picture in the bottom right hand of your screen. Nursing interventions, we need to educate our clients on antibiotics and making sure that they complete the entire course. There's complications that can come from untreated strep throat, including rheumatic fever, which is a serious illness, and it includes inflammation of the heart and blood vessels and joints, so we do not want it to turn into rheumatic fever. As nurses, we also want to educate to promote hydration and fluids. We want to remind the parents to change the toothbrush so that way the bacteria doesn't sit in a location that's going to reinfect that child. If the child is hospitalized, they will be placed on droplet precautions. That wraps up our voiceover on communicable diseases. If you guys have any questions, feel free to email me or you can ask me in lecture.